So good evening, everyone. We have some exciting stuff to share with you tonight. This is Tracy Dong, and she's part of our marketing team, and I'm Heber Michaels, CEO of Eber Health. Let me start by asking a question. In the past 12 months, how many of you guys have felt sick? Please raise your hand.
How many what?
Let me repeat that. How many of you guys have felt sick in the last 12 months? Some hands went up. As you can see, a lot of us feel sick. In today's world, when we feel sick, we truly only have three options. We can go to our primary care doctor, we can go to a nearby urgent care, like Zoom care, or we can go to the ER. All these options are either too expensive, too inconvenient, or require long waiting times. In an industry that has placed profits over patients, on behalf of the millennial generation, I just want to say, healthcare delivery is bullshit, and I'll explain why. In our generation, we've been able to request a ride, food, and even relationship companionship, all with the click of a button. For example, if I want to go in downtown from point A to point B, all I have to do is get an Uber or get a Lyft, and I'll be there. If I'm feeling lonely and I want to date someone, all I have to do is swipe right on Tinder and get a match. Although I do have to admit, my matches on Tinder have been pretty low.
You're grabbing the bottom of the mic, and that's what the cord is saying.
Have been pretty low. If I want to watch a movie online, all I have to do is log on to Netflix, and I can start Netflixing and chilling. And everything is done instantaneously. So we thought to ourselves, why not take the most time-consuming and complicated, frustrating part of our lives, health, and make it just as accessible? And that's what we've done. At Eber Health, we provide comfortable healthcare anywhere, all with the click of a button. Whether it be your home, your school, your office, or your work, we do this with a concept similar to that of Domino's Pizza delivery and Uber's functionality. Through the Eber app, you'll be able to have access to health providers all in real time. All our providers are reliable and professional, and we ensure this by doing an intensive background check. In addition to that, we have a rating system, and this ensures the highest quality of care ever. In order for each health provider to stay in our platform, they must maintain a 4 out of 5 star rating at all times. If not, they're done. They're off our platform. And we do this because we really care about the quality of care. We're also cashless and convenient. And although this is true, we do not store any credit card information because your privacy and your security really matters to us. And last, we've finally given healthcare to your hands. Through our app, you'll be able to request an acupuncture health provider, whether it be a doctor or a nurse practitioner, and massage therapist, all with the click of a button. So you may be wondering, how is this possible? How does this work? I'll illustrate it here. The first step of our 6-step process is getting the right people. We hire the right healthcare professionals, as I mentioned before, through an intensive background check. In addition, we've implemented GPS technology, which enables us to connect patients with doctors efficiently. We also have an insanely killer and easy to use user interface, which makes it easy and fun for all our users. We have patent pending backend technology as well. In addition, everything's 100% on the cloud, which keeps everything easy. You can check your medical records at any time of the day. And last but not least, we have partnerships with 70,000 different pharmacists across the nation. This includes Rite Aid, Safeway, Walgreens, any pharmacy around, we're most likely partner with them, and this is helpful for our e-prescription. So now I'm gonna illustrate the demo for you guys. All right, as you can see, here are two screens. The screen on the right is the patient side, and the screen on the left is the health provider side. The first thing you notice is the map and the GPS. We can locate exactly where you're at. At this point, we were at PSU. That's when we were testing this earlier today. To make an appointment, you just click Make an Appointment. You then have a list of services, but for time's sake, we'll choose Heber. Then you click Done, and then a pop-up screen comes up with all your details, first name, last name, phone number, and location. Once you confirm this, you click OK, done, and then an email confirmation will be sent to you immediately to your email. At the same time, our health providers will get a push notification. As you can see there on the top screen, they can choose the patient. Once they choose the patient, they'll know exactly where they're at and they'll have further details. Again, another pop-up screen will pop up, and right then they can make a call and have access to that patient's information instantaneously. As I mentioned, in an industry that has placed profits over patients, we believe that if you're too sick to leave your home, then a doctor should come to you. Thank you very much. Okay, questions?
So I had trouble with the.
Oh, just leave it.
I had a little trouble with you saying there was a killer interface. Maybe we have a healer interface. Maybe there's a better word. Something.
That's a good point. I didn't think of that. Go ahead.
Okay, what kind of partnerships do you have with either hospitals or medical groups and insurance companies and HMOs?
So right now we have no partnerships with them. We're trying to stay away from them more because we're trying to use the innovative side of the young generation. Although this is true, we do have partnerships with EHR platforms. In addition, at first we want to do everything direct payment, which makes it easier because we figured that once we get insurance involved, it makes the process a bit more complicated. Although this is true, we're open to the idea in the future of accepting insurance companies. So if anyone's from healthcare and wants to talk to us, we're open to that too.
So what about the price? So for example, if I am going to get the same service from a hospital versus your platform, so in terms of the price comparison.
That's a great question. I didn't really go over price. So he was asking the pricing, what's the pricing on the service? So our pricing is simple. It's $99, which is simple and easy for everyone. So a student, for example, let's take a student at PSU. A student at PSU has healthcare insurance through through the PSU school. If he goes to the ER, he'll have to pay a $300 deductible fee, a 20% copay, and $20 co-insurance. All this number adds up. With our service, we're doing that at $99 for right now, and they could do that they don't have to make it automatically, they can do it on payments, installment as well.
So when a doctor arrives at your location, what kind of equipment are they bringing with them? How are they doing the triage or the treatment?
That's a great question. So the first thing the doctor does is he calls you immediately to do the triage process there. Once he gets to the home, then he has a better idea on what to take. But most of our services that we've done, the visits we've done in the last month and a half have been upper respiratory illnesses, such as a cold, a fever, more of the urgent care needs.
So in the situation of a physician coming, or a doctor, primary care physician, whatever it is, coming to your home and then evaluating that you need to be referred, do they need to be a practicing physician at a local hospital to actually do the referral? Or how are you, like you just mentioned, triaging, are you triaging truly critical patients into an emergency situation?
So that's a great question. So the question was, how do we triage critical ill patients, and how do we separate them from the minor and the major illnesses? And that's done through the telephone call, the triage. If it's like an emergency, the medical doctor would tell them to call 911 immediately. If it's something that's further that needs X-rays or imaging, we do that through our partners. We have a partnership with 300 imaging locations in the U.S.
So taking like labs or anything like that,
Yep.
they would be able to facilitate that.
Yep, with one of our partners.
So first off, good job. It's really, really hard space, so I can't imagine even going into it. So great job there in your long ways. Along that same line, where I would be concerned is that $99, if I think of physicians and I think of the A students and the D students, which goes down to the doc in the box type of students, right? These guys are interested in $99 type of things, maybe because they have extra cycles in their day. But most physicians along that line are really, really busy. And so my concern would be that I'm going to get an RN that's maybe a traveling RN, maybe fully qualified, but that's the person who's going to show up. So trying to make sure that the right person is showing up and responding at the right price point, because that $99 is really inexpensive. And so that's the first part of the question. And then the second part is, how do they pay? Are they paying the physician directly and you're taking a piece of that? Or how does that compensation get passed?
Okay, the first part of the question, currently we're only onboarding right now. We have a doctor, and the other health providers are nurse practitioners. So we currently don't have any RNs. They're nurse practitioners. And the reason why nurse practitioners are cheaper than doctors, everyone knows, and they can prescribe, kind of a similar model that Zoom Care took. With the second half of your question,
how do they get paid? So
okay. The payment process. So the patient pays to us directly through the app, and then we get cut 5%, 10% cut, and the rest goes to the healthcare provider.
Thank you very much. Give it up